Welcome to Study Time, a televised home learning program produced by Rwanda Basic Education Board.
So, dear students, a very warm welcome to the biology lesson. I'm very happy to be with Senior 3 class again. We are now proceeding to Unit 18. And Unit 18 is concerning about HIV/AIDS, stigma, treatment, care, and support. That is the unit title. And we're going to have lesson 1. Lesson 1 are the rights of people living with HIV/AIDS, sexuality education, and programs promoting positive living with HIV and AIDS. So before I start the lesson, I would like to give you some diagrams, and you go through the diagrams. And the diagram will just give you a picture of what the lesson is about. All right? I have this diagram. See, protecting health care, people living with HIV/AIDS. By this in the diagram, people are trying to advocate how to do protecting and also give health care for people with HIV/AIDS, people who are living with HIV/AIDS. They are making an advocate. They are advocating for them. All right? I have, that is the diagram. So another diagram is trying to show you the two scenarios. The two scenarios is that we're talking about the two scenarios. Scenario 1 is we have a person who is sick. He's not feeling okay. He's not in a good condition. He's not having a healthy condition. Immediately after falling sick or showing some signs of symptoms of not falling okay, he has to visit the health worker or health center, the nearest health center. And immediately he go to the treatment. And after getting treated, he's now able to go and do and carry out his normal activities, digging, grazing, and doing other activities that can bring the family to be in a wealthy conditions that is helping the family. Then I have scenario B. The scenario B, a person is falling sick. And after falling sick, he knows maybe once I go to the health center for testing, they will find me that I'm HIV positive. And you just refuse of not going to the health center. At the end of the day, you go there when you are at the last stage, when when nobody can help you. Okay? They can try because, and by that time you are able to be admitted, and it can take you long to become okay. So it means that effects of stigma, that is stigma, hatred, discrimination, can bring you to become isolated. And you don't go to the health workers to get a treatment area. At the end, you can lose your life, and you can also lead in 2 days. So my friend, if you are HIV positive, basing on these two scenarios that I've been showing you, when you fall sick and you start suspecting yourself that you may be having HIV positive, go there and get an immediate treatment. You could feel okay, and you carry out your normal activities, which can also boost in terms of your family, which can financially can boost your family, however much you are HIV positive. Instead of being isolated, feeling that you are hated, you are stigmatized, at the end of the day, you lose hope. And if you lose hope, if you lose hope and even a reputation, at the end of the day, you will die. So these are the two scenarios that are bringing us to the lesson. The lesson is concerning about the rights of people who are living with HIV/AIDS. Make advocacy. Okay? Don't hate. Don't carry out the discrimination. Because if you bring all those things, that's why people will not die, because he has reached the last level, because he can die because of what you call being isolated, being hated, being isolated, all these can bring you to fall sick and also die immediately. So make advocates, go to the hospital. Those are the two diagrams that we're trying to show us. So let's start the lesson now. And I hope that everybody is ready with a pen and a book to take some important, to take the notes and even to do homework and lesson assessment. So the lesson, as I mentioned, it is just having two running objectives. State the rights of the people who are living with HIV/AIDS. What are the rights of people who are living with HIV/AIDS? You explain the importance and key elements of living positively with these people who are HIV positive. What are the important key elements of living positively with these people who are living with HIV/AIDS? So when we talk about HIV-related discrimination, stigma, I try to talk about HIV-related discrimination and even stigma, refers to the negative attitude. Negative attitude, prejudice, hatred, and even abuse against people who are living with HIV positive. So when you talk about negative, you have a negative attitude to a person. So they may be shunned by the family, you become shunned by the family. You become shunned by the peers, peer groups. Not only by the peer groups, you also become shunned by the community. While some may receive poor treatment in health care facilities. You find when you are sick and people know that you are HIV positive, you don't receive an equal care facilities as that one who is HIV negative. And even in the public, you're also not treated properly. Okay? They can't appoint you to become Omuyobozi w'Umudugudu because they know that you are HIV positive. Okay? So you find the community has shunned you. Okay? So the main causes associated with this stigma and even discrimination being they are called methods. Talk about methods, I've talked it several times. These are what you call misleading information. Okay? About the message about the transmission of HIV/AIDS. People, they don't have more knowledge about the transmission of HIV/AIDS. That's why they have to do discrimination, stigma, and etc. You talk about stigma, that is, in Kinyarwanda, I can call it kuguhakato. In such a way, you become isolated. And when you become isolated, you will be mentally disturbed. You will be not having you're not in a good social relationship with some people. At the end of the day, when you are socially disturbed, psychologically disturbed, what will be the outcome? The outcome is this. And you know that in Africa, a big percentage of people are living with HIV/AIDS. And people, they still have those methods about the transmission of HIV/AIDS. So these methods are misinformation, misleading information, or what you call ignorance. And fear, coupled with other reasons, having caused many people to false belief that people, they have what you call false beliefs that HIV positive, HIV and AIDS is associated with death. That is very clear. Once a person tells you that that person is HIV positive, you don't consider him as a person. You say, this one, HIV/AIDS, is associated with death. Those are methods, misleading information or misinformation. HIV and AIDS is a result of what you call irresponsible behaviors, and you deserve to be punished. All right? In a family, they know that maybe you are HIV positive. They may think that that is irresponsible behavior that you did, and you deserve a punishment. All right? So that is another thing. On the other hand, HIV and AIDS is only transmitted. People, they know that HIV/AIDS is transmitted through sexual intercourse. And when you go back to the to our common understanding, there are some of the young babies that are born when they are HIV positive. They got HIV positive during childbirth. Not only that, you can also become HIV positive not during sexual intercourse, also through blood transfusion. Not only that, you can also get HIV positive through sharing of sharp objects, needles, and etc., razor blades, and etc. All those things can bring you to become HIV positive. But people, the mindset of the people, they do think that you suffered from HIV/AIDS because of sexual intercourse, and which is a taboo subject in many cultures. Doing sexual intercourse, in some of the cultures, they take it as a taboo. So one may get infected if they are associated with people with HIV/AIDS. People living with HIV/AIDS faces various challenges associated with the stigma, as I talked it. One of the challenges that are faced by the people who are living with HIV/AIDS is, number one, is discrimination, stigma, hatred, shunned by the family. All those are challenges that are faced by the people who are living with HIV/AIDS. So they include loss of income. When all this happens, automatically the loss of income will also come, because a people resort himself or be becoming, knowing that he has HIV positive, and HIV positive means the death. If it means the death, what does it mean? It means that she will start hating herself or himself. So it becomes what you call loss of income. People will start selling his properties, buildings and homes, and even land, so that you know that I'm HIV positive and I'm associated with death. Livelihood, umuntu bugira gute umushiramo. Okay? Livelihood. Okay? So reputation. Reputation, icyubahiro. Marriage, and even loss of hope. All these things can also happen. So no person living with HIV/AIDS should be discriminated against, should be stigmatized. So people living with HIV/AIDS have the rights to medication or medical treatment and care from health facilities. They have the right of getting medical treatment and even including care from health facilities. Number three, no one can be dismissed from the work because he or she is HIV positive. So employees, you should not dismiss anybody because he's HIV positive. That is the rights of people who are living with HIV positive. Number four, no one should be forced to take HIV test in any situation. You can go somewhere, you are looking for a job, but they tell you that, please, you need a job, but before we give you a job, we have to test you HIV positive. So no one should be forced to take HIV test in any situation, for example, for getting a job. Those are the rights of people who are living with HIV positive. Okay? Children living with HIV positive and AIDS should be allowed to attend any school. That one is an official gazette of the government. When you try to check in these articles concerning about the rights of people who are living with HIV/AIDS, also that article is there of telling a child living with HIV/AIDS should be allowed to attend any school. 6, pregnant women living with HIV/AIDS have the right to make the choice about the pregnancy. Talk about having the right of the pregnancy, it means she can decide to terminate the pregnancy. I'm talking about making abortion, terminating the pregnancy, based on what you call the condition of the health condition of the person. All right? So the pregnant women living with HIV/AIDS have the right to make a choice about the pregnancy. You've ever had people talking about the rates of abortion, what and what, but people are living with HIV/AIDS, they have the right for their pregnancy. 7, another 7 rights, the rights of people who are living with HIV/AIDS. That is another right. Testing the results can be shown to any other person. These tests that has been done are not allowed to be shown by any person without the permission of the person who took the test. The doctor can take a test, testing results, but he should not be able to expose the result to any person without your period permission, without the permission from the real person. Okay? Let's talk about now. We are through with the rights of people who are living with HIV/AIDS. My friend, go through those rights are very important. They can make you to increase your days, your lifespan. Because we said if you are not treated very well, the outcomes are very many. Okay? You lose hope, which leads into losing the income because you know that you are going to die tomorrow. Dying tomorrow, that is, there's no tomorrow, there's no future for tomorrow. And not only that, also livelihood also is going, reputation is also going, which can also lead into marriage problems. Okay? So let's talk about sexuality education and programs promoting positive living with people who are HIV/AIDS. We're going to have what we call sexuality education, and even programs that can be able to enhance, to promote, to live positively with people who are having HIV/AIDS. So education programs and campaigns, all right? And campaigns are important in order to reduce the HIV/AIDS infection rates. We have to carry out campaigns. Many organizations run prevention and education programs. These organizations use methods such as, what are these methods they can use in terms of campaigns and programs? Talking about educative programs, such as they use the TV adverts, billboards, pamphlets, and even radios. So the message passed in this campaign is directed to the general public. They go to the general public. So let's talk about all members of the community should be informed about HIV/AIDS. My friend, we normally do umuganda. So when you're doing umuganda, maybe at the end of umuganda, they also do what you call a meeting after umuganda. So my friend, the community should be aware, should be given information about HIV/AIDS. Although vulnerable groups should be also targeted first. You also have to target the vulnerable groups. What is vulnerable groups I'm talking about? So we talk about the community should be having maybe not the full information, but having information about HIV/AIDS. And also the vulnerable groups should be targeted. Okay? When you're targeting, you try to target the vulnerable groups. So these vulnerable groups are more likely to contract HIV/AIDS, and this includes students. Surely, let me just give you time to think, what are these vulnerable groups? Good. The vulnerable groups, including what you call sexual active youth. They are sexually active. Sex workers. Talk about sex workers. We talked about people who are doing sex for financial gain. Sex workers. So these are vulnerable groups. They have to be targeted very much. That's why you find the government is trying to put in some of the bars, they put there some condoms so that these vulnerable groups, sex workers, can be easily access the condoms without paying any price. All right? We talk about men and women who are already HIV positive. They have to be targeted and are spreading it to the other people by engaging in discriminating sexual behaviors. Okay? So men and women also have to be targeted who are already HIV positive and are spreading it to other people by engaging it in discriminating sexual behaviors. Women who are in a relationship with partners who are HIV positive and do not have a power to decide on the use of condom. So they have these health workers, they have to target these groups because sometimes you may find the husband is HIV positive, the wife is HIV negative. So it will bring what you call misunderstandings. How can we use the condom? And I've talked about HIV positive. If a person says that he's HIV positive, immediately what comes into your mind is the mindset, the methods. You may think that that person is associated with a death. Public education programs on sexuality aiming at encouraging people to. What does public education have to do? Talk about public education. As you see, this is a public education about, all right, so people living with HIV/AIDS, then we have promoting a positive living with HIV/AIDS, okay? And I have what you call sexuality education. So public education programs on sexuality should be aiming to encouraging people to do what? Get tested by visiting voluntary testing and counseling centers. You have ever seen what you call AHA? Is it AHF? Okay? Protecting themselves against the spread of the virus should also be another program on sexuality by the public centers. Access treatment and care when infected. So it means that they have to access a treatment. Their medication should be at a lower price, or sometimes should just be given freely. Treat people living with HIV/AIDS with dignity they deserve, because they have to be treated with the dignity they deserve, because they can go for hospital, they can go in health facilities. You find he's not treated with the dignity as he deserves it. Okay? We also have to mention we have to mention also most people who are HIV positive are not aware of their status, and therefore, unknowingly, they spread the virus during the early stages of infection. Okay? You find you don't know your status, okay? So education programs emphasize on everyone to be tested. I talked about VCT, voluntary testing and counseling. So everyone has to be tested, okay, to prevent the spread of the virus and encourage positive living. People who are influential in society, students, when we talk about the people who are influential, I should be among of the people who can be influential because I'm a teacher. Think about other people who are influential. Let's talk about religious leaders. Let's talk about the politicians, okay? Traditional leaders, teachers should be involved in promotion of the campaign on living positively with HIV positive. This is very clear. So people who are influential in society should take a hand, all right, to make campaigns on living positively with HIV/AIDS. Okay? I mentioned them. I talked about politicians. I talked about religious leaders. I talked about traditional leaders. I talked about teachers should be involved in promoting of campaigns in living positively with HIV/AIDS. Positive living. When we talk about positive living, what are positive living? Lifestyles adopted by the HIV/AIDS infected people or person in order to live life as a fully and possibly. We're trying to throwing the progress to HIV/AIDS. So adopting the positive living practice improves the quality of life. Or people are living with HIV/AIDS remarkably. Important aspect of positive living for people with HIV/AIDS includes making a positive choices to care for one's mental. You have to make a positive choice to care for one's mental and physical health, and having a positive outlook on life, and even avoiding what you call risky behaviors. Risky behaviors, we talk about risky behavior, that is, someone knows that he's HIV positive, he starts involving himself or herself in drug abuse, in alcohol drinking, and other things that which would just be a risky behavior, which could lead him to die at an early stage. Okay? Positive living involves what? What are these positive living that I'm talking about? Students, take time to think about what are these positive living I'm trying to mention. So positive living, that is preventing the spread of HIV/AIDS patients who are on antiretroviral therapy, RRT, antiretroviral therapy, can transmit HIV/AIDS even if treatment has been effective. You may find the treatment has been effective. Okay? So to prevent the spread of HIV patients who are on antiretroviral therapy can transmit HIV/AIDS even if the treatment has been effective. There is also a possibility of reinfection with different strains which can accelerate the infection. Another positive living is that people, you may find that he has the tablets, he has been given these medications, but he tries to hide the medication. So taking medications as prescribed by the health workers to prevent a further infection. So my dear friend, if you are a child who is HIV positive, if you're a person who is HIV positive, don't hide the medications. Take it as it has been prescribed by the health care providers or health workers. Okay? Next one, working as an energy arouse and avoiding stress. Try to avoid stress. Try to think that you've been rejected. Maintaining a good nutrition status, because if you want to have a good health, bear in mind to have what you call a nutrition status is essential for improving the quality of health. You know, these days, people we are having a pandemic of COVID, but we don't have a clear medicine for it. But what we do is having a good nutrition status. It will just try to boost your immune system, and eventually you become healed. They are able to be followed day by day, because at the beginning people could know that he is a COVID-19. He could be starting things that is associated with this. Same applies to HIV/AIDS. If you are HIV/AIDS, have a good nutrition status, and essential for improving the quality of health, and they should eat a well-balanced diet. Get regular exercises and even medical care. So students, we are coming to the end of the lesson. When you come to the end of the lesson, I can't leave you without testing your understanding. Okay? I'm going to leave you with almost 7 numbers. So you have to go through these 7 numbers, and they are concerning about rights of people living with HIV/AIDS. So students, thank you very much for your active participation and listening of this lesson. And I wish you to stay safe and enjoy the rest of the day. Bye.